The top 10 dental scams. There have been studies, even though it seems impossible to believe, that show that over 75% of dentists overtreat. Several dental clinics have been proven to perform unnecessary treatments, and it's estimated that over $12 billion is spent on dental scams. And as corporate clinics take over America, it seems more and more dental scams are being done. So that's why we are here today to talk about the top 10 biggest dental scams. Number 10, Medicaid and overtreatment. See, the problem with Medicaid is that the patient doesn't have to pay anything. Because the patient doesn't have to pay anything, the government is. The more fillings the dentist does, the more money the clinic makes. So it's very common to see Medicaid clinics where patients need 10, 20, or even more fillings. I've had many patients on Medicaid that come see me that might need 1 or 2 fillings, but they had been told they needed over 20 fillings. Number 9, crowns and overcrowning. Similar to doing too many fillings, doing too many crowns. See, many insurances pay for 1 to 2 crowns per year, and so it just happens that the patient needs 1 to 2 crowns every single year. And eventually, the patient runs out of teeth to put crowns on. And so what happens? The dentist replaces the crowns, because most insurances allow you to replace the crown after 5 years. And so they're just continually finding 1 or 2 crowns per patient, every single patient they see, to be able to make decent money. Number 8, clear liners. Being told that clear liners can fix everything. Clear liners are clear trays that go over your teeth that allow your teeth to push and move. But very difficult movement, overcrowding, overbite, underbite, things like that are almost impossible to fix with clear liners. But the dentist wants to sell the treatment so much that they will try to convince you that it will fix anything. And clear liners are very easy for a dentist. See, the company like Invisalign makes all the clear liners. All the dentist has to do is take your impression, send it to the company sends the aligners back, and that's basically all the dentist has to do. So it's very easy money for a dentist. That's often why they'll try to convince you that it can almost treat anything. Number 7, deep cleanings. There are many times that patients are told they need deep cleans when they don't. Now, there's definitely times patients need deep cleanings, but I worked at a clinic that anybody that hadn't had a clean for 6 months automatically needed deep cleaning, no matter how healthy their teeth were. And deep cleans are where you numb the gums, where you go way deep into the gums and remove subgingival calculus, which at many times is needed. But there are times where a patient could not have had a cleaning for an entire year, but they did such good oral health care at home that they don't need a deep cleaning. Normal cleanings are around $100, whereas a deep clean can be over $1,000, sometimes $1,500. So there's definitely a huge incentive for the dental clinic to convince you to do a deep clean over a regular cleaning. Number 6, over X-rays. After working overseas and coming back to the US, it was really crazy to see how many X-rays in the US they take. Now, X-rays are important. There's many times you can diagnose, but full mall series taking 20 X-rays and then taking a pan and then doing a 3D Ceph and X-ray, 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 it just sometimes just seems too much. And it just seems that in the US, they take a few too many X-rays. Number 5, just doing bad work. Many times the patient will never know if the dentist does bad work. For example, in a root canal, even a bad root canal will do good for a few years. The difference is how long will it last? And by 2 to 3 years, the patient has probably moved on, or by that time, the warranty on the root canal is expired. And so it doesn't really affect the dentist if they do bad work. A bad filling, again, will take the pain away, fix everything, but it will cause food to get trapped. And once that food gets trapped, it will cause a secondary cavity, but that usually takes 1 to 2 years. So unfortunately, there are dentists that don't do the best quality of work, and patients just don't know because they're not a dentist. Number 4, only doing what you're trained on. Many dentists don't know how to place implants, so they'll never tell you to get an implant. Instead, they'll tell you other options like getting a bridge. But the problem with getting a bridge is you can't floss between your teeth. You also have to affect 2 neighboring teeth that might be very healthy. And it happens all the time where the dentist doesn't know how to do other things, so they convince you to do exactly what they know, which might not be the best option for you. Number 3, specialties. They have specialties on treating children. They have specialties on treating the gums. They have specialties on taking out teeth. They have specialties on moving your teeth. Orthodontists with braces. They have specialties in almost everything in dentistry. And the problem with specialties is they will often charge much higher fees than if you went to a general dentist. And so the problem is going to see a specialist when possibly you could have had just as good work done by a general dentist, because if you see the specialist, you're going to pay double, sometimes triple the price. Number 2, an all-on-4. All-on-4s are being sold like crazy, and if you haven't heard about that, that's where you take out all your teeth, put in 4 big implants, and then anchor that with new fake teeth, which sounds maybe good, but the problem with that is these implants are a last resort. To be able to place these implants, you have to cut away significant bone. Once your bone is cut away, it will never come back. And if an all-on-4 doesn't work, again, you have 4 implants, 1 implant fails, you are screwed. You are stuck in dentures basically the rest of your life, or trying to battle to get an implant. There are many times you could do normal implants or try and save the teeth, because again, an all-on-4 should be a last resort, because if it doesn't work, you have no other options. Number 1, not doing the simple thing. We just had this. We had a patient that came in that was told she needed over $50,000 to take out her teeth and put in implants. And we realized it was really only 3 teeth that needed to come out. And you could fix her teeth with bridges and do everything. We did everything for about $3K. She got a few extra stuff, so it was around $5K, but not nearly the $50,000 that she had to spend. And we see it all the time, patients being told out they need all their teeth out, or they need different things. We just had a patient the other day drive over 3 hours to see us because he had been told the exact same thing. And all we needed to do was do deep cleans, and he could save his teeth for another 5 to 10 years. So again, many times dentists focus on the price and doing a big thing when just a small little quick fix is all that is needed. At the end of the day, the most common thing is overtreatment with dentists, and that is the most common scams. Scams are so common that insurance companies have made words for ways that dentists scam them. Upcoding. That means when a dentist does a certain procedure but says they did something else that's more expensive so the dental clinic can get more money. Unbundling claims. That's where the dentist does a procedure but instead sends it to the insurance as 4 different procedures because that would actually be more money. So to end with, there are many good dentists, and there are many dentists that really care about their patients. But there are some that will try to be really nice and try to act like your best friend and will be out to scam you. So just be careful when going to the dentist. I highly recommend you always get a second opinion.